Here are 3 things I don't do as a neurologist, inspired by cases I've seen. Number 1 is I don't let my kids run around with a toothbrush in their mouth. This is because I've seen several cases now where kids fall on their toothbrush while running and tripped and has significant injuries. The cases I've seen were strokes caused by this, because when a child falls with a toothbrush or any object in their mouth, it can penetrate the pharynx, and at the right angle, it can actually injure the internal carotid artery that runs just behind that space. This artery supplies blood to the brain, and if a clot forms or if it gets torn, it can block blood flow to the brain and cause a stroke. Number 2, I don't recommend taking too much Pepto-Bismol. People often use it for stomach issues, and while it's safe in short bursts, using it for prolonged periods or at high doses can be dangerous. This is because bismuth is a metal, and when it builds up in the body, it can cross into the brain, and in there, it can interfere with how brain cells communicate and can even affect how the cells produce energy. These cases can be misdiagnosed as irreversible forms of dementia or movement disorders. Older adults or those with kidney impairment can be at high risk for this because clearance of bismuth in these populations is slower. Number 3, I don't ignore the potential neurologic complications of shingles, especially when it affects the face. This is because when the VZV virus affects the face, especially around the eye, it can travel along nerves and infect the walls of cerebral arteries, which causes vasculitis, which is an inflammation and narrowing of blood vessels. I've seen multiple cases of this where it can reduce blood flow or lead to clot formation, both of which increase the risk of stroke. Number 1 way to prevent this is the shingles vaccine. But if you or someone you know have stroke-like symptoms after shingles, you have to let your doctors know because it can change how you're treated.